So we're going to move now to House File 745. Representative Hornstein is here with us. And since he's not on the committee, the chair will move that House File 745 be laid over for possible inclusion in the finance bill. Welcome, Representative Hornstein.
Thank you so much, Madam Chair and members. I'm very pleased to present House File 745 to the committee. House File 745 protects people living with HIV in Minnesota by exempting medications for the prevention or treatment of HIV from medical assistance and MinnesotaCare copayments. It removes barriers to care and increases access to HIV medications to ultimately end HIV in Minnesota. And I would add, Madam Chair and members, that while the infection rate has flattened in recent years, we do anticipate an uptick this year. There have been several areas that we're seeing. So when the data comes out soon, I think you will see an increase in the rate here in Minnesota. So what does the bill do? It establishes a program to assist HIV related to drug copay and lab costs for low-income individuals. It exempts medications for the prevention and treatment of HIV from medical assistance and MinnesotaCare copayments. It ensures that no person living with HIV in Minnesota loses access to life-saving medication because of a copayment requirement. It ensures that no one is forced to choose between paying for HIV medications or food. We see that quite often. It provides access to antiretroviral medications, and people living with AIDS can achieve and sustain undetectable status or viral suppression. It provides access to pre-exposure prophylaxis and post-exposure prophylactics to prevent new HIV infections. And finally, Madam Chair, in 2018, 64% of people living with AIDS were virally suppressed. And these changes to co-payments, we can see the number increase and more people reach an undetectable viral level. So with that, Madam Chair, I do have several testifiers and would be happy to answer any questions.
All right. Thank you very much, Representative Hornstein. So we have I have three people on the list and then one who's there, I think, to answer questions if necessary. So we're going to start with Dr. Caston. Welcome to the committee.
Hi, thanks so much for allowing me to speak and just lend my voice in support of this bill. So I'm an infectious disease physician. I work at Mayo Clinic in the HIV clinic, but I'm not here as a representative as Mayo. I just wanted to offer my own support. So I've been taking care of people living with HIV or at risk of acquiring HIV for over 30 years. And those of you who are my age know the amazing strides that we've made with this disease because of the fact that we have great treatment, as has been well voiced by others on the call. Not only do we have great treatment, we also have medication that is once a day that can prevent HIV infection. If we can keep people who are HIV infected on treatment, and as was mentioned, virologically suppressed, then they cannot transmit HIV to others. So not only are they going to stay healthy, but this is a public health matter, right? We don't want other people to get infected. And so although, yes, medications can be expensive, in the long run, it's less expensive to keep people on treatment, make sure they don't infect to others, and to make sure that people who recognize that they're at risk, are interested in taking a preventive medicine, can also stay on preventive therapy. So I would say that not only does this bill, if it's passed and we eliminate copays, not only benefit patients who are infected or trying to prevent getting infected, it also benefits society. I know that the copays to some might seem small, but as has already been voiced, for some of our patients, this is a major barrier. If they go to the pharmacy and try to pick up their medication and they have a copay of $10, $25, that might not be anything for those of us on this call, but for them, they may not be able to afford that. They're going to say, you know, I have other things that are more important for me, like buying formula for my kid or buying diapers for my kid, rather than staying on my HIV medications or on my PrEP. And so therefore, I just want to really put my voice out there as in support of this bill, and I thank you for giving it good consideration.
Thank you very much, Dr. Kasten. We appreciate you being here with us today. I have Val Rubin Rashad Crutcher. Welcome.
Hi, thank you. Thank you, Madam Chair and committee members for the opportunity to speak today. My name is Valerie Rubin Rashad Crutcher, and I'm the Executive Director of the Youth and AIDS Projects. We're a nonprofit housed in the University of Minnesota Department of Peds. We also offer medical case management, HIV prevention services, and sexual health education for those people living with HIV ages 13 to 30. I'd like to say that many of the people that I work with are unaccompanied and homeless youth. 40% of those young people enrolled in YAP are unstably housed with limited access to resources. Having this particular barrier taken away would make such a huge difference in the lives of people we serve. I've had countless conversations with people over the years with clients who have foregone getting their medications because they could not afford copays for the same reasons that Dr. MJ just listed. This is not just a concern for their physical health and their financial health. I would also argue that it affects mental well-being as well, as I have had clients reported to me that this has affected their mental health. As they miss doses, it causes them to not be virally suppressed, which in turn may lead to more HIV positive cases. So again, in removing this barrier and increase access to care, it will help Minnesota move towards their goal of ending HIV. And again, I'll keep it brief, but I want to thank you for the opportunity to speak.
Thank you very much. We appreciate that testimony. We have Megan Williams. Welcome.
Thank you. I am trying to show my video, but I'll begin. Good afternoon. My name is Megan Williams, and thank you for your time today. I'm a registered nurse, and I have a master's in public health. I'm currently the Director of Nursing and Home Care Services for Claire Housing, which is a nonprofit providing housing and healthcare to formerly homeless people living with HIV and AIDS. We currently serve over 200 households in the metro area. Over 85% of our residents are engaged in care and virally suppressed, which means that the viral load is suppressed to a point that they cannot pass on their HIV sexually. This success is due to the low barrier supportive housing environment and advocacy Claire Housing provides. I'm here today to say all barriers to accessing HIV prevention and treatment medications, such as paying copays, obtaining prescriptions from providers for PrEP and PEP, and placing life-saving medications on preferred drug lists and requiring prior authorizations should be eliminated. Claire Housing's residents and others in the HIV community utilizing medical assistance face serious financial challenges in paying these copays, as we've heard from our other testifiers. HIV medication copays can range anywhere from $10 to hundreds of dollars a month. And if you are homeless, unemployed, not making a living wage, on medical assistance, and only have $104 to live on a month, people will be forced to making choices, which we've seen before in the community, for paying, whether to pay rent, food, or for medications. If barriers continue to be created for people living with AIDS to access life-saving medication, they're at a greater risk of dying, seeking expensive care in the emergency department in our hospitals, and increasing the community viral load and the spread of HIV. Eliminating these barriers are simple public health and fiscally responsible measures that can be implemented to uphold Minnesota's commitment to end HIV and address health inequities. Thank you for your time.
All right. Well, thank you very much for your testimony. I know that Matt Toburin is here for questions. I think we will see, I'm not seeing any questions from members. So, and I'm not aware that we have a fiscal note for this bill yet, but I'm sure that one is in process. Mr. Berg, if you're on, could you just confirm that?
Madam Chair, that's correct. There is a fiscal note request for this bill and the next one. They have not yet been completed.
All right. Well, thank you very much. And so Thank you very much to all the testifiers. Thank you, Representative Hornstein. This is one of those bills that we'll have to see what we have available to spend, and certainly I think that you've all made an excellent case for this bill. So with that, House File 745 is laid over for possible inclusion in the finance bill.
Thank you,
Next-
Madam Chair.
Thank you.